Some unsettling numbers for parents coming out of the U.S. today. The Center for Disease Control says there has been an alarming rise in autism rates in the United States. Researchers are under even more pressure to figure out the cause of autism. The CBC's medical specialist, Dr. Karl Kabasele, joins me live with the details. Dr. Karl, what are these alarming numbers?
Well, according to this new report, it looks like there's been an increase, at least in terms of the way that they're doing surveillance for autism. So in this particular case, they actually looked at 14 centers around the U.S., so it's not necessarily representative of the whole country. But in those 14 centers, they've noticed an increase in the overall prevalence of autism among 8-year-olds, and it went up. So 2 years previous, in the 2006 numbers they looked at, the number was about just a little bit under 1%, and now from 2008, the number has risen to just over 1%. So there is this observed increase.
Okay, so as I understand it, in real numbers, it translates to, and correct me if I'm wrong, about 1 in 88 children in the United States has autism, the highest estimate to date. And that's an increase of 25% since the last analysis in 2006, double the reported rate from 2002.
Yeah, and so the numbers do sound perhaps a little alarming, but I think it's important to sort of throw in all of the caveats that go around these numbers. So first of all, we should say that these are autism spectrum disorders, so it includes autism, but also Asperger's and other developmental problems. So that's number one. Number two, what they did was they actually looked at not so much the reported level of diagnosis or numbers of diagnosed kids with autism and autism spectrum disorders, but they looked at the actual health records and educational records of these kids and used their own experts to figure out whether this child fit the definition of what they were looking for. And yes, the numbers have gone up, but again, when you say 1 in 88, that's true, but the actual percentage is about 1.1% of the kids. So it's not sort of a huge number, but it is an increase.
And in Canada, what's the number here in Canada?
Well, in Canada, the number we use right now, Autism Speaks Canada says we're about 1 in 110. But as you can imagine, because part of the reason why the numbers do shift and fluctuate is that the definitions change, and we're also getting better at identifying these conditions. So whether it's because parents are more aware or teachers are more aware, or because clinicians and physicians and so on are identifying it more often. So we're not necessarily saying there are more kids with autism, but maybe we're finding out about more of them.
You know what's really worrisome about this is for parents who are looking at this, for parents who perhaps have a child who has autism, they're saying, the rates appear to be going up, and yet we don't know what causes this disease.
That is definitely something that the ongoing research is trying to discover, a sort of a biological basis for autism. And once we sort of nail that down, hopefully there will be we'll be able to test for it, maybe a blood test or something. But we're probably still far away from that. But let me just say the reason why a test would be so helpful is that we know that the earlier you can make the diagnosis of an autism spectrum disorder, and you start to implement the special education and the social supports and so on, the better off these children are in terms of maximizing their educational and sort of functional capacity.
All right, CBC medical specialist Dr. Karl Kabasele, thank you once again for joining me in Toronto, Karl. Appreciate it.
Thank you.